Welcome everyone. This is Dr. Jaitly, your cardiologist from New York, on your favorite website, MuniMeterHealth.com, which is dedicated to educating the general masses as well as the medical fraternity. On your favorite website, MuniMeterHealth.com, I acknowledge my thanks once again to all of you viewers who are growing by the numbers, by the day, primarily for contributing a great deal of support to our growing website here. Again, the clinical education is prime, which is so important for all of us, primarily for the medical fraternity, but patient education is equally as important. Just remember that in order to improve the clinical outcomes. And that's where my initiative comes in over the past 35 to 40 years, where I've been telling all my students and residents and fellows, please educate your patients as well in order to achieve the best clinical outcomes possible. So having ascertained all of this, we fully understand that this is primarily again a teaching a tool or a teaching site, if you will. Again, it's a supplement to your text, but do not replace your text, do not substitute your text. Supplement your text with these video formats. Today's discussion will be primarily based on a very rare kind of an arthritis, if you will. It's called Churg. Some of you may have heard of it, Strauss syndrome. Now, just so that you know, it's always on the boards. Even if you clinically, you may never see it in your life, but just I always said these rare syndromes are always on the board, whether it's internal medicine or cardiovascular. But you should know that one question will always be there, related or indirectly related. So you should know some basic information about it. One, it occurs at the age of 35 to 50. So it can occur in children also, but 35 to 50 is the peak age where it manifests. It's a form of an angiitis, remember that? So there is an angiitis that's occurring. So that's angiitis implying inflammation of the arteries, as simple as that. So you'll not forget that. Now, common denominator for all these cases, they must have some form of an allergic phenomenon like a rhinitis going on. So they have a running nose, they have constant allergies. Invariably, they have asthma. Very, very important finding, asthma. They may also have some pulmonary infiltrates. Remember that. So this is part of your syndrome. So asthma is a common denominator, but pulmonary infiltrates in an asthmatic patient is something which is very additionally seen, because normally asthmatic patients, they reverse and don't develop pulmonary infiltrates or nodules, if you will. Nodules are also seen in these cases. So, it's a form of an arthritis, and because it's an form of an arthritis, we need to know which organs are affected. Obviously, 4 major ones, and we'll say one is the cerebral. Very importantly is coronaries, which we are discussing primarily because on MuniMeter Health, we primarily stress our cardiac manifestations here related to any syndromes here. So, coronaries. Thirdly, the renal. And fourthly is the splanchnic arteries, and the splanchnic arteries can be involved, like the mesenteric arteries, if you will. So once these arteries are involved, then at that point we say, okay, well, now we have the manifestations to go along with, and we'll discuss those in a second. Now, etiology wise, what are the causes? Well, the etiology is unknown, so most of the times it's idiopathic. We have no idea what's going on in this allergic idiopathic arthritis, if you will. And again, we know that it's only small to medium-sized arteries are affected, not the big ones. The big ones we know about, we have already discussed in a different video called Takahashi arthritis that affects only the aorta, for instance. So just so that you know. Now, very importantly, some of the leukotriene like substances like leukotriene antagonists, for instance, if they have been used in patients who have been treated for asthma, for instance, and now all of a sudden what you may call a Churg-Strauss syndrome is precipitated. So in asthmatic patients, now this is a very, very important finding. Now, you'd like to see asthmatic patients be treated with leukotriene antagonists, but some of the cases with asthma, if they tend to precipitate a syndrome of CSS, which is, as I said, all these things we just talked about, the pulmonary infiltrates and the allergic rhinitis and obviously cerebral, renal, coronary involvement, etc., then one can suspect that CSS is going on in these asthmatic patients. But asthma is quite a huge denominator in all these cases, so just remember that. So without asthma, you should not be able to diagnose CSS. The suspicion is extremely high only if asthma is present. That's the key. But again, it's a rare condition, so your suspicion is still not that high within your differential. Now, having said that, so that's your number one. The second thing that in etiology comes to your mind is ANCA antibodies. These are anti-neutrophilic cytoplasmic antibodies. So basically, the antigen here is either myeloperoxidase, which is present in the neutrophils, or it's the proteinase 3. So we call it myeloperoxidase, which is MPO or P3. Now, MPO has a pattern which is called the C pattern. Just remember that. And it's the P pattern. I call it the P pattern. And P3 has the C pattern. Okay. So this is where. So the C pattern is the cytoplasmic pattern, and the P pattern is the perinuclear pattern. Now, predominantly for all CSS, so all CSS will have a positive P pattern right here. This one, the P pattern will be present. So that means what are they reacting to? Most of them, they are reacting to MPO. Okay, so very few cases may be positive, very few cases, but predominantly it is the P pattern. Very few cases will have the C pattern, and then of course they are reacting to the proteinase 3. Okay, so those are the two antigens which are present in all your neutrophils, and remember that, and that's why these are anti-neutrophilic cytoplasmic antibodies. That's why we call them ANCA. So predominantly, and this is very, very important. Why? Because the diagnosis is you have a differential here, and a differential diagnosis will be with the Wegener's Granulomatosis. Wegener's Granulomatosis, you have the reverse pattern. You have more of a C pattern, which is positive in these patients. Just remember that. So this is very, very important, and they'll give you a differential here. And if it is a C pattern, another important differential with Wegener's is you'll have a cavity. The cavitation is pretty much a norm, I would say. It's pretty much a norm in all patients with pulmonary nodules. So all these nodules that will develop, they will have cavitations as well. Very rarely a cavitation occurs in a setting of CSS. So Wegener's, yes, cavitation is a prominent feature here. Now, what do you understand by cavitation? Let's understand what cavitation is. For instance, here we draw our chest, my favorite schematic. Here's your heart. Right here, the central mediastinum. Now, the infiltrates we can show from a different color here, if you will. And of course, the colors are a little bit more like this. So these infiltrates, or these nodules, if you will, they will cavitate in Wegener's, but they do not cavitate, no cavity, in a setting where there is CSS. So just remember that, no cavity. So it's one of those findings that very important. And again, the infiltrates can be present in these asthmatic patients, and cavities are some of the things that one sees. Now, coronaries, I'd like to show where the arteritis occurs. So again, we can show some arteries here and arteries here. For instance, one of them is the left anterior descending. This is circumflex, and say for all practical purposes, these all have branches and they intermingle with each other like a coronary tree, which we have discussed more in detail. Here's your aorta coming out from the top. So the coronaries can develop a form of an arteritis, and that leads to heart failure, CHF. It can also lead to ischemia. So that's the other part. So CHF. So predominantly most patients who die. Why is Churg-Strauss syndrome important on MuniMeterHealth for us? Because unfortunately, it's the myocarditis, pericarditis, and the coronary arteritis that's responsible for the mortality. So you have myocarditis. Okay, there is pericarditis in the form of inflammation of the pericardium, and there's chest pain, and all these patients will develop heart failure. They'll also develop signs of shortness of breath and pedal edema and what have you. And then, of course, you'll have coronary arteritis as well. So these patients can have myocardial ischemia and infarctions also at the age of 35 to 50. So these are very, very important features of Churg-Strauss syndrome, just so that you know. The treatment, because it's allergic and we do not know the etiology, corticosteroids are the number one choice, and one gives 1 milligram per kilo as a bolus, and you can give it as pulse therapy also for 1 to 3 days. very important, and one can put these patients into remission. But sometimes for maintenance purposes you may require cyclophosphamide. So CP therapy is required in these patients, and there the dose is very easy to remember, also 2 milligrams per kilo, and that can be given. Again, you have to watch out for renal impairment in these patients, so just make sure the renal functions are okay, and the renal functions are okay, then you can give cyclophosphamide at the regular dose of 2 milligrams. Otherwise the doses will have to be renally adjusted. Just remember that. But steroids in general, they show dramatic improvement as soon as you give steroid. Well, steroids, we know most of the arthritis and most of the angiitis, a lot of connective tissue disorders, they are just wonder drugs, and we have not even been able to come up with another better drug than steroids. So very important. Okay, so this was in a nutshell your Churg-Strauss syndrome. By the way, in etiology, I just wanted to mention, I did mention about the leukotriene antagonist, which prone an asthmatic patient to develop CSS, ANCA's antibodies, and thirdly, do not forget also that thymic antibodies, the T1 cells, have been implicated. T1 macrophages have been also infiltrated. So if you have leukotriene antagonists, which are precipitating an asthmatic patient to go into CSS, we have ANCA antibodies, predominantly the MPO, and then the T1 cells. So these are the 3 etiological agents, just so that you remember. And of course, we still don't know the entire cause in all these patients, but just remember that 40% of these patients will have an MPO positive P pattern type of thing, whereas ANCA positive, whereas in Wegener's you will have a C pattern which is present, and that C pattern is right here, and that C pattern will just remember C also for cavity, so you'll remember that Wegener's go with C pattern and a cavity formation in the pulmonary nodules. Okay, so if you see a pulmonary infiltrate on a chest X-ray on the board examination where there's some cavity formation, they talk about a C pattern type of a ANCA antibody, the diagnosis is Wegener's. Otherwise it is the other differential. Okay. All right, we'll discuss Wegener's at some other point, but just that was the closest differential I had for you here. But remember, Churg-Strauss syndrome is a very rare entity, but should be also studied, and it's a form of arthritis, which is affecting all these various organs. So thank you again for watching MuniMeterHealth.com, and this is your favorite website, which is giving you the closest look at various cardiovascular manifestations in various disease entities. We try to cover clinical and medical education, obviously, for our medical fraternity groups, but also we like to extend our information and education primarily for our patients as well. Remember, this is only a teaching tool, a teaching website. It's not a medical advice site, so please be cautious of that, and mostly to enhance education, because that's what is important for us in order to improve the clinical outcomes. Okay, I thank you again, and stay tuned for more exciting stuff happening down the line in our video vignettes on MuniMeterHealth.com, your favorite website. So long.